Examination of the shoulder. Start by examining the patient's cervical spine. So I'm just going to ask you to face that door away from me and just have a look at the back of the neck. And I'm going to just palpate, I'm just going to press down your spine, okay? Just down to thoracic is fine. Okay, and then if you turn around and face this way again, I'm just going to check some movements of your neck. So if I'd just like you to put your chin on your chest for me, please, and then take it up and look all the way up to the ceiling, and then go back to a sort of neutral position and put this ear to this shoulder, and the same on the other side. And then if you look over this shoulder towards that corner, and do the same on the other side. Okay, that's fine. So happy with the C-spine, the neck, everything looks okay. I'd just like you to turn to face me a little bit more, and I'm going to just inspect your shoulder and have a look for any signs of asymmetry, any scars to suggest old operations, any gross swelling or bony prominences that look unequal. That's fine, and if you just turn the face away from me, I'll do the same on the back, paying particular interest with the scapula. Again, looking for any asymmetry, any swelling, bony prominence. That's fine. If you stay there, I'm just going to ask you to do some movements to have a look at your scapula here, your shoulder blades. So if you shrug your shoulders up, okay, and if you scrunch your shoulder blades together at the back, okay, and roll your shoulders forward and go back to a normal position. Then if you bring your arms out to the side of you, and then bring them all the way up over your head, and then bring your arms back down again, that's fine. And that's just looking for scapular dyskinesia, any abnormality in the scapular movement, asymmetry between the two. So if you turn back round, I'm just going to feel your shoulder joint now. Start here in your chest at your proximal clavicle. Just feel along here, down to the AC joint, to the humeral head. And if you ask the patient to turn their hand out, you can feel the bicep tendon. And then if you just bring your arm up, just get the patient to abduct their arm a bit, you can feel the pec tendon. Try not to laugh. That's fine. And to test the biceps tendon more, what you can do is, you can get the patient, in a minute I'm going to ask you to turn your hand over like this, against my hand. This is resisted supination, so if you do it now, if there was bicep tendon pathology, that would elicit some pain in there. And then if you straighten your elbow, I'm going to hold here again, just try and push your arm up towards the ceiling, bring your arm up. Again, that's another test for bicep tendinopathy or pathology. I'm going to have a feel of your shoulder at the back, if that's okay, so if you just turn the face away from me. So staying with the right shoulder. We've done the C-spine, but you can feel the scapula, where supraspinatus would sit, under the spine of the scapula, infraspinatus, the posterior joint line, the posterior humerus. That's fine. If you turn back to face me, I'm going to get you to do some movements. So first one, if you could put both your arms up in front of you and bring them up over your head as much as you can, that's fine. And then bring them back down, and then put them behind you, and then go back to your by your side. If you bring them up to the side and meet in the middle over your head, that's fine. And then if you bring your elbows up like this, for internal and external rotation, and if you can bring your arms like that, and then back down. And then if you turn around, I'm going to get you to put your hands behind your back with your thumbs in the middle of your spine, and try and slide them back as far as you can. Okay, that's fine. Just put your thumbs in the centre, and then you can measure this for progress if people are struggling with internal rotation, so you can check that. That's fine. Put your hands down. If you just turn back round, you can check for a slap tear. So a Bryan's test. If you keep your arms straight and put it across your body, and just turn there. I'm going to try and push your arm down. You try and keep it up. That's fine. Okay. And then we can assess your rotator cuff muscles. So I'm going to get you to pretend you've got a can of Coke. Hold it out in front of you. Empty your can of Coke. I'm going to push your arm down. You try and keep it up. Okay, that's fine. So that's supraspinatus. For infraspinatus, tuck your elbows in like that. In a minute, I'm going to get you to move the arm out like that, and I'm going to resist it. Okay. That's fine. And then for subscapularis, if you turn around, I'm going to get you to put this arm behind your back with your palm facing outwards and just push off against my hand. That's fine, okay. And for subacromial impingement syndrome, you can do Neer's test, which is where you have the patient with their arm straight, and if you just turn your wrist inwards I'm going to hold here and just raise your arm up. Okay, that's fine, you can put it down. And finally we can just check the neurovascular status. So I'm going to touch your arm, you can just tell me if you can feel it or not, okay?
Yeah. Yeah. Yeah.
Just hold your hand up.
Yeah. Yeah. Yeah.
That's fine, I'm just going to feel some pulses, so just one here. And you ready to pulse here? And then just check for power. So in a minute I'm going to get you to try and lift your arms up against me, okay? And then I'm going to get you to pull them back down towards you. So if you try and lift them towards the air, and pull them back down. And then if you put your arms in front of you like this, try and pull me towards you. And then try and push me away. Okay, spread your fingers like this. Don't let me squash your fingers together. Okay, and then if you just with this hand, if you let your wrist drop, in a minute I'm going to get you to do that with your wrist, okay? That's fine, and turn your hand over and try and touch your little finger with your thumb like that. Okay, that's fine, that concludes the examination.